While that new variant looms on the horizon, right now the number of people who've been infected with COVID-19 here in our country is about the same as the total populations of New York and Massachusetts combined. The CDC says more than 21 million doses of the COVID-19 vaccine have been given across the U.S. That's up more than 1.3 million doses from the days before. CNN's Natasha Chen has the details behind those numbers this morning.
The U.S. has now surpassed 25 million coronavirus cases, and the death toll continues to climb, with more than 3,000 people who have died of COVID-19 every day in the last 4 days. And the Institute for Health Metrics and Evaluation projects a total of 569,000 Americans will have died from coronavirus by May 1st. Javier Becerra, President Biden's nominee to run Health and Human Services, described it this way on Sunday.
The plane is in a nosedive, and we got to pull it up. And you're not going to do that overnight. But we're going to pull it up. We have to pull it up. Failure is not an option here.
But there has been some good news. The same model that predicted 569,000 deaths also shows nearly 43,000 people's lives may be saved in that same time frame thanks to vaccination. And the 7-day moving average of new cases in the U.S. is starting to drop after an aggressive post-holiday peak. And the positivity rate stayed low enough in Chicago for restaurants and bars to restart limited indoor dining.
When the rumors started swirling around our staff that it was going to be able to happen, there was a spark in everybody's eyes to be able to know that we're going to be able to do what we do best once again. And that's an exciting thing for us in the hospitality profession.
That same look of excitement and gratitude.
Oh, they're from you? How sweet. That's so very kind.
Is in the eyes of millions of people lining up to be vaccinated around the country, including now mobile and pop-up vaccination sites run by companies like Amazon. The challenge is getting more supply distributed to what's currently a patchwork of local health providers who are sometimes battling website crashes and scheduling mishaps.
No one knew what the hell they're doing, so they send everybody home.
If this is happening to me, and I'm well educated, my husband's a state senator, if this is happening to me, what's happening to people who don't have what I have and don't have the access that I have?
Meanwhile, officials have their eye on coronavirus variants and how well the vaccine may hold up as the virus changes.
It means we've got to, number one, do much better genomic surveillance so we can identify variants when they arise. It means we've got to double down on public health measures like masking and avoiding indoor gatherings. The bottom line is we're in a race against these variants. The virus is going to change, and it's up to us to adapt and to make sure that we're staying ahead.